The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. I'm glad you tuned in. It's Gil Lederman, and we're ending the weekend in a nice way. Going to talk about a lot of things together, and if you have questions, again, we are live. Noah and Ed are in the controls, and I've got all the wires connected, so WOR is functioning at 152% because they are the best. So if you call the studio, Noah or Ed will answer. Their number is 1-800-321-0710. Again, 800-321-0710. So we have a lot to talk about, a lot of news, a lot of patience, a lot of insight, a lot of lessons. And just sit back and hopefully you can enjoy and learn a lot tonight. We had a call this week from a man whose PSA doubled from 10 to 20. And I have to wonder what he's been doing to get it to 10. And then it doubled. So we've got two worrisome things. Number one, a very high PSA. PSA is prostatic-specific antigen, and that is very high at 20 now. And then you've got the PSA velocity, that in a short period of time, it doubled from 10 to 20. So it's suggestive of a very aggressive cancer. And he told me, don't worry. He called me up. He told me, don't worry, Doc. I'm going to the chief of XYZ hospital or chief of Zimbabwe hospital, and I'm going to get a biopsy. And I said, well, that's great, but number one, sometimes the chiefs of the department don't see many patients. Sometimes you want to see a urologist that treats patients every day, or maybe you want to come and see us because, for example, if you go to the chief of a big cancer hospital nearby, and this is data that's in our booklet, so you're welcome to call us during the work week, Monday through Friday, 9 to 5, and we'll mail you the booklet. But it actually has the data of the results from the chief of big XYZ cancer hospital. And what's his results if you have a PSA more than 20 to 50, which would be the range. Okay, so if you have a PSA 20 to 50 and he removes the prostate, what's the likelihood of being cancer-free? Now, a lot of people think if you remove the cancer and you're in the prostate, you're home free. A lot of people think that. But look at the data. Again, this is Figure 7, page 6, our new prostate booklet. And the answer is 44% of men are cancer-free at 5 years. 60% of people have relapsed. So surgery for prostate cancer is not very good. And in the next column, here's the results from Lederman with our program using brachytherapy and treatment in the stereotactic frame. Treatment's all outpatient. You come in and get a treatment and go home or go to work or go to lunch or go to the movies. Our results are 66% better. Wow. So if you're having prostate cancer or any cancer, even some benign tumors like brain tumors, meningiomas, acoustic neuromas, you might want to give a call. You might want to make your first decision to be the best one. Because, for example, with prostate cancer, once you have the prostate removed, it sets a whole cascade out from spreading the cancer, number one, to damage to sexual and urinary function. And that's actually on our page 14, figure 21. What percent of men, here's a great question for you, what percent of men who have open surgery have no sexual problem after surgery? This is a Harvard study. It's not my data. It's not my numbers. Harvard study. If you have open surgery, and remember they're supposed to be watching that nerve, the nerves, what percent have no sexual problem after surgery? 2.9%. Wow. That means 97% of men after surgery have sexual problems. Now, everyone's tooting the horn of this robotic device, Da Vinci. What percent of men, according to the Harvard study, have no sexual problem after robotic surgery? It's even worse, 2.3%. So I know they're tooting the horn that robotics is supposed to be better, but actually in this study from Harvard Medical School, both results, open surgery and robotic, were both lousy. What was lousier? Robotic. And that's true also for urinary problems. What percent of men had no urinary problem after open surgery? 19%. After robotic surgery, what had no problem? 13%. Meaning 80% of men had urinary problems after open or robotic surgery. So again, you may want to look at that data and think about it and call. And as I tell everybody, it's really best to come in and spend an hour of your time, invest an hour of your time, and try to learn the details before you make that move. It's a little bit like a chess game. If you make that move and you lose your queen, it's hard to get it back. Well, in health and cancer, that's even more so. And on the other end of the spectrum, here came in this week a 66-year-old man. He had a PSA. Now, before I talked about PSA of 20, this man had a PSA of 0.071. Now, it's not 7.1. It's not 0.71. It's 0.071. And he went to another hospital, and guess what they wanted to do? Yeah, you're right. They wanted to do a biopsy of his prostate. Now, the man came in, took a history, got the data, examined him, had a normal prostate exam. His PSA was 0.071. This man, home free, no biopsies needed. He has a normal exam, a very low PSA. He's in great shape. So just by coming in, he saved an unnecessary procedure. And most likely, at age 66 with that low PSA, most likely he's going to be fine for the rest of his life. But we'll follow him. We'll report back to you 5 years, 10 years, whatever it is. We'll tell you. And in a completely different page, we'll talk about a physician with colon cancer. Now, this man was diagnosed 10 years ago. Actually, at his daughter's wedding 10 years ago, he collapsed because of bleeding and anemia. He had a colon cancer, which was undiagnosed. And the anemia brought attention to the cancer. He was diagnosed and treated. And yet, after routine surgery and chemo, the cancer came back. And for the last 5 years, he's had chemo. And he's had lots of symptoms. He's gone to a big doctor at a big cancer hospital and had lots of chemo. And over the years, he's had many symptoms. He had abdominal pain. He got more chemo. He had shortness of breath. He got more chemo. He had hoarseness. He got more chemo. Finally, this man, who I know very well, came and said, "Can you help me?" And we got staging. The same thing I tell most every patient: you need to be staged to know exactly where the cancer is and why you have these symptoms. And lo and behold, he had a massive cancer, metastasis to the root of the mesentery. The mesentery is what holds the bowels in place in the abdomen. And that most probably was causing his pain because it's near nerves that can cause pain. He had a mass in the airway, which was blocking the oxygen from getting into his lung, making him short of breath. And he had another mass by the aortic arch, pinching the recurrent laryngeal nerve, the nerve that is responsible to move the vocal cords. Now, if the vocal cords don't move properly, they become paralyzed, air slips through the vocal cords. So there's a hoarseness. And furthermore, you can't close the vocal cords, so air is always leaking out of your lungs, making more shortness of breath. So he was very eager to have treatment to try to relieve the pain, to try to breathe better, and to try to get his voice back. And last year, in fact, with stereotactic radiosurgery, which is a non-invasive method of treatment. So I know radiosurgery sounds like it's cutting and bleeding, but there is no cutting and bleeding. We attacked all 3 sites, one at a time, because I like people to be comfortable and to feel that our treatment is helping. So we treated first the mesenteric root mass, and his pain went away. Then we treated the mass in the airway, which was obstructing the air from getting into the lung, and his breathing improved. And then we treated the mass around the aortic arch, which was pinching his recurrent laryngeal nerve, which had, in fact, made him hoarse for years. But he had always hoped that the chemo was going to do the job. It didn't. And that radiosurgery helped with his voice, too. That was a year ago. He comes back now with a new PET scan and has been on chemo, which really has trouble tolerating the chemo. It gives him diarrhea and gives him numbness, and he's lost a lot of weight. We restaged him, and restaging means we look again and see where exactly the cancer is. All the cancer in his body had progressed, everywhere, except for 3 spots: the root of the mesentery, the airway, and the aortic arch pinching that nerve. Those were the only tumors that were dead in the water. So now he feels like chemo's not for him because the cancer's growing in many areas. Still working as a doctor. This guy is sharp as a tack, probably the most brilliant man I know. And he wants us to treat the 3 biggest tumors in the lung, which we've worked with radiologists. We've identified those, and we actually started that this week. So here's to this man and his good health. Let's wish him well. Hope we can help in the past like we have in the future. By the way, radiosurgery is very different than chemotherapy. As you know, with chemotherapy, often the cancer mutates or evolves to resist chemo. So often the chemo that you had yesterday won't work today. Radiosurgery, on the other hand, works in billions and billions of different ways, and the cancer can't outwit it, which is why it works so well. It also works well because we can localize the cancer, we can find it, we can try to avoid hitting the healthy tissues with the same dose, and we can dial up the dose. So instead of weeks and weeks of radiation like many people get, here it's only 5 treatments, easy to get, fast to get. Usual treatment's about 15 minutes. This man came for his treatment during lunch break and then went back and saw his patients. So he's done great. The treatments worked great. Right now we're 3 for 3. That's better than Ted Williams, who batted 400. And we hope the next 3 spots will go into oblivion as well. And then he continues his good, important work. We're going to stop for just a moment and listen to these several voices to talk about our work. My name is Dr. Lederman from Radiosurgery New York. We're at 1384 Broadway, 1384 Broadway, which is on Broadway just between Times Square and Macy's in Manhattan. Chose that spot because it's super convenient to get to by Penn Station and Grand Central and Port Authority and most all buses, trains, and subways in New York City, the PATH trains. So it's easy to get to and it's super convenient, but we're not only super convenient, we answer the phones. You'll have a doctor, not a student or resident, taking care of you. You'll have your questions answered. We're a private cancer treatment center, which means we work for you, not the drug companies, not the surgeons. You're our boss. You're the President of the United States of your body, and we work for you, the President of your body. So again, if you have questions, call us at 212-CHOICES. If you want the booklets we've discussed or DVD, just call us during the work week, 9 to 5, Monday through Friday, and we will send it out at no